Hello, welcome to our live session. This is Shweta Saraswat from Bacha Panthi. April is the Stress Awareness Month, which gives us opportunity to raise awareness about stress and encourage people to take steps towards less stressful and more healthier life. So today we have invited Dr. Deepti, who's going to talk about why it is important to know about stress, how to deal with it, what all early interventions and non-drug approaches we can take or implement even before stress reaches us. So let's welcome Dr. Shyamala Deepti. How are you doing today?
Doing good. Thank you, Shweta. How are you?
Good. Thank you for coming. Let's start this session with your brief intro.
Hello everyone. I'm Dr. Shyamala Deepti. I'm currently practicing as an outpatient psychiatrist at Ohio Health Marion General Hospital. I thank Bachapanti for this opportunity.
Thank you for coming. As we are expanded in 10 countries, each month we celebrate different countries' events and festivals. Like last month, we had a wonderful session with moms from India, Germany, and United States, where we talk about Women's Day, how women contribute to our society on International Women's Day. So this month, our Bachapanti families knew that we're going to be talking about Stress Awareness Month, and we got the opportunity to have you here, so they sent us plenty of questions, which we're going to be discussing today. So the most common question that the families gave us is, what causes stress? How we differentiate the unique stressors that kids face compared to grown-ups or adults. So just put some highlight on.
Sure. So, everyone experiences stress at some point in their life, irrespective of their age. And stress can be short term, or even it could be a long term one. And a small amount of stress, I think it's good for all of us because it can keep us motivated to perform our daily tasks. However, if you have something which is severe or chronic stress, that can lead to severe mental and physical health problems. It can affect your body, your mind, feelings, and thoughts as well. So I would just list out few examples for stressors for children and adults. For adults, major it is any life-changing events like losing a job or switching jobs, or if they're exposed to any traumatic events or going through a divorce, could be some of the stressors. For children, it is more of the academic functioning, like having difficulties with pursuing higher grades, or completing their tasks on time, or submitting their assignments on time. Also, changing schools or changing places, or switching the routine of children, like birth of a new sibling, or even changing, like I said, new schools can also lead to a lot of adjustment problems in a child.
True. And as you said, this stress leads to many physical and mental health problems. So our research team is dedicatedly working in different areas to see how our program can help in early interventions of these illnesses. So when we were exploring, what we found is medical research estimates 90% of the illness is stress related, that can lead to physical and mental health problems, as you just said. So, what are the most common mental health problems due to stress?
Well, it's a very broad topic, Shweta. So I had to just, be as brief as possible for this time. But I would love to do more sessions with you later. A few problems that I commonly see on a clinical practice is anxiety, depression, behavioral problems like mood disturbances, irritability, and agitation. Apart from this, children also suffer from some learning disorders like ADHD, which means attention deficit hyperactivity disorder, or even reading disorder or mathematics disorder. These are some of the problems that we commonly see on a clinical practice.
Yeah, when I talk to the parents, is the most common that they say that my kid is very hyperactive, they can't sit at one place. Uh,
Right.
are not able to focus. They get irritated very easily, so anger issue. So these are the behavioral problems. Can you explain anxiety and depression in a simple language, and what are the common signs and symptoms?
Sure. So, anxiety is a feeling fear or scared or a feeling of uneasiness. And anxiety can present in the form of panic attacks, which means where you feel short of breath, having chest tightness, you have palpitations, you feel sweaty, shaky, and you have difficulty focusing, and it can last for about few minutes. Apart from panic attacks, there's another form of anxiety called a social anxiety, where you feel anxious being around people, or being around crowds or going to malls, and stuff like that can make you very anxious. And some of the population can also present in the form of generalized anxiety disorder, which means you just worry about everything, like almost day-to-day activities make you very, very anxious. Now, coming to depression, it's feeling of sadness, which means you can present with symptoms of low mood, something called as anhedonia, which means you lack the interest in doing pleasurable activities, like the things that you used to enjoy before, you no longer enjoy them. And having crying spells, feelings of hopelessness, feelings of helplessness, low energy, lack of concentration, disturbances in the sleep and appetite. Some of these symptoms can also, contribute to depression. These are some of the signs and symptoms I'm just briefly, mentioned here.
This is much
Yeah.
clearer now. Thank you for that. Our another question from the parents is about the stats of these mental health problems. So when we were trying to look, I googled on like CDC, which it's a Center of Disease Control
Right.
Prevention
Right.
site, which I'm going to tell a little bit about our general population. CDC is the Center of Disease Control and Prevention site, which keeps track of recent health trends, talks about the cause of different diseases or the new diseases, outcomes, and their recent treatments in the market or the recent research, ongoing research on that. So what I found is 5 to 6 million US kids have behavioral problems and anxiety, and 2.7 million kids have depression. And this increased over time, especially with the kids who are between 6 to 17 years old. And this increased from 5.4% in 2003 to 9.2% by 2012, 11.2% by 2019, and tremendous increase post-COVID. So, based on your clinical experience, what kind of patient you see in the clinic, and what do you tell us a little bit about your experience that getting most common patient after COVID?
Sure. So, we have noticed that there's a rapid increase in cases, and especially mental health conditions. There's a rapid increase after COVID exposure. At least there are like at least 80% of anxiety disorders and 70% of depressive disorders have been identified. Along with that, there's something called as long COVID syndrome, which is also called as long haul syndrome. It's called as I mean, patients can present with extreme tiredness or weakness. They can have something called as brain fog, where they have difficulty remembering things. They can also have difficulty staying focused. So, which is all part of this COVID syndrome, which occurs after acute illness, after acute COVID illness. That is one other thing that I've observed. I've also observed a few cases of something called as obsessive compulsive disorder, which is called as OCD in short, which means people get very obsessed about cleaning constantly, checking doors constantly, or making sure that things are arranged in a certain way. Those are the things that we kind of observe. But I have noticed that especially people are preoccupied with sanitizing their homes, or whether it's their vegetables or whatever it could be. I think they were so much obsessed during that period of time.
I know. I kept seeing in my office as well, like they are holding the door knobs with the like a paper towel. They don't want to touch the doorknob because they
Right.
don't know who else has touched that doorknob. Mom is
Yeah.
very suggestive with cleaning and all after this COVID. She every time when something comes out from outside, she's like,
Sure.
okay, clean that because maybe there is a virus on that. So she tries to clean it with alcohol and everything. So yeah,
Right.
going back to your fatigue thing, I definitely heard from most of the family members or that when they had COVID, they had extreme weakness. They are not able to get it from that for a month or so. So
Right. Right.
these are the wow, that's so good to know. Thank you. Another questions from the families is what can be the healthy ways or tips that you can give to manage stress that can help themselves to calm down during overwhelming situations. So if you can highlight some points so that our families know about this. Thank
Sure. Sure. So, first of all, I would insist on being aware, like having self awareness of what are the signs and symptoms of anxiety or depression, or it could be any other mental health disorder. So I would encourage the parents to, have an open conversation with the children, see what they're struggling with, and help them reach out to any trustworthy person among the family members, or they can even talk to a teacher or a school counselor, or even they can approach a mental health professional if they really need some help. And the second most important thing is doing some deep breathing exercises, including yoga, meditation, brain stimulating activities like solving puzzles or brain gem exercises, and also including some art or music. I think all of them would be very relaxing for the children. Apart from this, making some lifestyle modifications like changes in your sleep, or make sure that you sleep adequately, like at least 6 to 8 hours of sleep, or at least 9 to 10 hours in children. And make sure that they eat healthy, and also regular exercise at least for 30 minutes a day, some kind of physical activity. I think it boosts their energy levels and release the happy hormones. So I think that's very essential as well. uh, Along with this, parents should spend some quality of time with the children as well, and having a positive self-talk and starting your day with a positive note. It boosts your self-esteem as well. It's important to teach children some effective coping skills. When they're in crisis, or when they're upset, how do they manage anxiety? They can just calm down by doing this deep breathing exercises, or they can just journal their thoughts, or even they can do some painting, some craft work, whatever that works for them. Also, praising the kids' success, or little moments of success that they have here and there at school, or whether it's sports, whatever it could be. I think you should celebrate so that it boosts their confidence levels and also motivate them to do much better. And also, I would suggest, you should focus on what that needs to be controlled, like what you can control. Like for example, if they say if they have an exam, they have exam that is coming up, and they just want to be better prepared, so that they will be less stressed out. So I think it's important to focus on what you can control and not in the things that you cannot control. And also, I think spending time with nature, like taking just a short walk, in the nature, I think it's very relaxing. It also releases the stress and gives you some happy hormones. So I think those are the few tips I can suggest as of now.
Awesome. These are too many. And thank you so much for the wonderful tips and explaining all these like mental problems in an easy, understandable way. So, as Dr. Deepti said, it is very important to have open discussion with your parents, should have open discussion with your kids, be open to them, know them well, reward them for small things. So, before I wrap up this session, I would like to have your last message to the audience.
Sure. Um, I would first of all suggest erasing the social stigma that we have about mental health. And this can be done only by educating people. educating them so that they can identify these disorders at a very early age, or taking early interventions by using healthy coping skills like the ones we mentioned earlier. And like we discussed, highly recommend parents to have an open discussion with the children, and whatever they're struggling with, whether it could be anxiety or depression or any other mood symptoms.
Big
uh,
problems.
yeah, yes, I think it's important to have a discussion with their parents, so that it can be hindered at a very early age, and they can have a better quality of life as an adult.
Awesome. There is no health without the mental health. Give your kids early interventions like meditation, yoga, as you said, brain stimulating activities. Feel free to reach us if you want, and this is for my audience. Feel free to reach us if you want to teach your kids meditation in a healthy way. Dr. Deepti's kids are with us for a long time and they are doing phenomenal. We Feel free to reach Dr. Deepti with any questions if you have. She is like a family to us. She is very easy to reach, though pretty busy, but she really takes out time for us. So thank you so much for your precious time today and your valuable insights. We really appreciate that. You have a great evening.
Yeah, thank you so much for giving me this opportunity. And yeah, you have a good weekend.
Thank you so much. Bye.
Bye.